Welcome to EMR Insight webinars sponsored by McKesson, where physicians talk about their experiences surrounding EMRs and the impact on their practice. In this 6-minute episode, Secrets of Gaining Physician Adoption, Dr. Tim Young with Omni Medical Group offers insights into gaining EMR adoption among providers and tips about managing change. He'll talk about the role leadership takes, the importance of planning and communication, and where to find the time to get it done.
We told them that there would be some significant advantages to having an electronic medical record. The main advantage being that they would have instant access to the patient's medical information wherever they were. So if they were at home and on call, they'd have access. If they were in the emergency department, they'd have access. If they were on a floor of the hospital, they'd have access. If their patient was seen in another Omni office across town, that physician would have access. So this universally available information. And at the time, we were still on paper charts, and the drawbacks of paper were fresh in their minds. It was physically limited to one location. Papers were always falling out of charts. Charts were being lost, and then you had no information. So that was a significant selling point. Well, the role of physician leadership in managing physician change is maybe a little bit intangible in the sense that I believe physicians always respond better to other physicians when it comes to changing what they're doing. And that's why we have physician leadership in Omni that some medical groups don't have. I just believe that physicians always respond better to other physicians. So when I'm going to a physician and saying, I want you to use this electronic medical record, and here's why, I can say, when I was in practice and when I was seeing patients, this would have been great to have. And so we have that shared experience about what it's like. So I think that's critical in physician leadership, that physicians just work better with other physicians when it comes to these sorts of things. The last holdout, the last person who just didn't want to do it, came to me 18 months after his office went on. Said, I didn't like this. I didn't want to do it. I've been subconsciously fighting it ever since. But I just realized this week I'd never go back to paper. It's just too convenient and too nice to have all the information wherever I want it. All the physicians went through training. I believe we started with 2 days of physician training for the first offices. They trained with their nurses on how to use it. Then when the office went live, we had one IT support person for each physician the first week. And so we were one-on-one, and they followed the physician every day for a full week to help them with issues as they came up or other problems they might encounter. The second week, we dropped back to one support for every 2 docs. And then the third week, one support for the entire office. We also cut back schedules the first week that they went on to 50% of their usual schedule. Although interestingly enough, every office had at least one physician who by the end of the first week was back to their full schedule. So we had some people who picked it up very, very quickly. Then we got to the point where we could usually do one office a month, roll out one office a month. The advice I give any group starting with an electronic medical record is to start with your advocates. You'll have someone, and the younger your group, the more advocates you'll have for it. Because a lot of people coming out of training now have used an electronic health record and will want to use one in your group as well. So start with that group, get them on your side, let them be your change agents, let them spread the word about how great this is. Start with them. Have some early successes and some good stories you can tell the folks who are willing to do it but aren't quite advocates yet. Then go with that group and save the folks that you know are going to be resistant until the last. I think it's clear that physicians are going to have to use electronic health records in the future. So it's just something that's going to happen. What we've noticed with physicians coming out of residency is having an EMR is actually a great recruiting tool. Because if you've been to a VA, you've used an electronic medical record in your training, and they like it and they want to use it. So it's actually been a great recruiting tool, because up until just this year, we were the only group in Tulsa that had one. So we were actually able to get some good recruits just based on that. There's good evidence that it's better for patient care, and our physicians' experience has been it's better for them practicing. So I think all those things together, it's just something you're going to have to do. The sooner the better.
Thank you for watching Secrets of Gaining Physician Adoption, sponsored by McKesson. Don't miss the next episode of EMR Insight Webinars, a real-world look at EMRs and quality of care. If you'd like to know more about Practice Partner, the same solution at work in Omni Medical Group, and used by over 8,000 other providers, call 1-800-770-7674 today, or visit us online at www.practicepartner.com.